Mr Deputy Speaker, and I'm very glad to speak to this matter of public importance because despite the disgraceful Medicare scare campaign run by Labor on the Central Coast at the last federal election, healthcare is in fact a very, very positive story that the coalition government can tell on the Central Coast. Far from what members opposite would have people believe, the Central Coast is a region where new and world-class health infrastructure is being rolled out to more people than ever before. It's a region with record-high bulk billing rates under a coalition government, and it's a region where, after years of neglect by Labor representatives, the coalition is determined to deliver a plan to see more doctors become available for local families where they're needed the most. So if members opposite want to know what real action on healthcare looks like, they should in fact look to the Central Coast, and they would see how this government has been setting a new standard of excellence in healthcare for our region. Contrast this with the 6 years of Labor representation during the Rudd-Gillard-Rudd years, when Belinda Neal and now Senator Deborah ONeill were the members for Robertson, and the Central Coast was falling into a very poor state of health indeed. And may I remind members opposite that Labor's cuts during this time included $1 billion from Medicare for dental and $500 million from Medicare for pathology. I remind them that Labor cut $664 million from Medicare for GPs, $450 million from the Medicare safety net protections, $2.5 billion from pharmacy and medicines, and $4 billion from the private health insurance rebate for consumers, and they means-tested. It's a very long list. And as the minister stated so clearly, and it hardly needs repeating, it was Labor who introduced, created, owned and authored the Medicare freeze. And now Labor refuses to back its unfunded $57 billion hospitals promise, their biggest cut in waiting. What's more, Labor, represented on the Central Coast by then-members Belinda Neal and Deborah ONeill, failed the people of the Central Coast by letting the GP shortage on the peninsula become a crisis. They did this by simply doing nothing, especially on the peninsula. So in contrast, we acted, including in 2015 when the coalition made vital changes to the District of Workforce shortage calculations so that now the most up-to-date data is used to identify areas where there's a doctor shortage. And this change has meant greater availability of doctors in 26 new suburbs in Robertson. Then recently we engaged with health experts and health professionals to host a community forum packed with around 100 people where we committed to address this problem. The Assistant Minister for Health, Dr David Gillespie, joined me at the forum at Yamina Beach, and I look forward to sitting down with him again tomorrow with key medical recruiters here in Parliament. And this also comes as bulk billing rates hit record highs, meaning patients are getting more benefit from Medicare than ever before. Nationally, as we've already heard, GP bulk billing rates have jumped to 85.4% during the second half of 2016, and this is even higher in my electorate, where it's around 87%, and it's almost 91% in the member for Dobell's own electorate, but you don't hear these facts coming from Labor. So let this be clear. The coalition government has a rock-solid commitment to Medicare, and funding is increasing by around $1 billion every year. We've also got a rock-solid commitment to the pharmaceutical benefit scheme, and from next month the cost of more than 1,100 medicine brands are being reduced, with vital new drugs being added to the PBS for people with conditions including high cholesterol, Parkinson's disease, depression and breast cancer. The coalition government has also got a generous and sustainable hospital funding agreement which delivers an additional $2.9 billion in public hospital funding. That's $7.9 billion more funding than Labor did in its last year of government. Finally, let me underline how the coalition government is clearly demonstrating its commitment to world-class healthcare on the Central Coast. We've set up a groundbreaking new medical precinct task force for the Central Coast, which includes representatives from government, the University of Newcastle and health experts from the private and public sectors. We didn't hear a word about this when Labor represented the region. Established with the assistance of the Minister for Health when he served as the Minister for Industry and Innovation, the task force is an Australian-first pilot that will seek to build on our $32.5 million investment in the Central Coast Medical School and Medical Research Institute, again nothing that occurred under the Labor government. This is based at Gosford Hospital, which is in itself undergoing a $348 million expansion thanks to the New South Wales Liberal government. There are 750 jobs that will flow from the Medical Research Institute and school, with a facility to be on track to be complete by 2019. I could not be more proud of the work that this government is doing to deliver better standards of health care to people who need it most on the Central Coast and indeed around Australia.